From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children. Friday morning is 9:31 right here in the studios of Sunny 88.7 FM, and welcome you all to Cradle to Crayon Show. We are live across the world on www.sunnygh.com. We say thank you to our sponsors, Back Specialist Hospital and Fertility Center, and also to Back Clinic. Now, this morning, I have here in the studio the ENT specialist. We had him a week ago where we talked about foreign objects in the ENT. I'm wondering there have been times when, as parents, you've heard your children snore at night. And the question is it really normal or is something we should ignore? So this morning, we want to talk about snoring in children, whether it's something that parents should be worried about, what actually causes the children to snore, and when they should be brought in early enough for medical attention. But before they want to pick a break, a message from our sponsor, A Time with Dr. Abner, as she talks about allergies. We'll be back.
When I was a kid, we had this guy in our class who was always sneezing or blowing his nose. And nobody wanted to sit with him in class because we're all afraid we'll catch his cold. Now I know better. Kids who do that may have allergies, Sadly, such kids suffer quietly because no one pays any attention. Some people even label them as annoying. Most allergies are mild, but any kid with allergies can have a severe life-threatening reaction if the circumstances are right for that. But help is available. So talk to your child's doctor and let's make life easier for our kids with allergies.
Yes, welcome back. It's a Cradle to Crayon Show right here, brought to you by Back Specialist Hospital and Fertility Center. Now visit Back Specialist Hospital for all your fertility, maternal and general health concerns. Their services include IVF, IU and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, the surgical service, that with general surgery and plastic surgery, and also theater service, and laboratory and ultrasound scan services, amongst others. Locate them right here in Accra, they are in Taifa, or call them on 0558 862 292 or 0592 196003. Back Specialist Hospital and Fertility Center, integrity and excellence in health care. Our WhatsApp line is 0540 13068. For in the course of the show, we'll open our phone lines. My guest this morning is Dr. Kwabena Ejenim Boateng, ENT specialist from Kolibu. Good morning to you, Doc.
Good morning, Abigail.
Yes, it's good to have you back here again.
Yes, good. It's good to see you once again, Abigail.
Yes. So, snoring in children. What do you, when you say snoring, what is it? What are we talking about? What is the process? How does this whole thing snoring? How does it work?
All right, it's fine. So when we say snoring in children or snoring in general, we mean simply noisy breathing whilst you are asleep. Essentially that. And as to how it comes about, the thing is that generally when you have a narrowed airway for whatever reason, and the reasons that an airway can be narrowed are varied, and many, several of them. But for whatever reason, if there is a narrowed airway, especially at the upper airway, then during time when you are asleep, the airflow becomes turbulent because of resistance to the airflow, and the turbulence generates the noise that we hear. Yes, so that is it. The noisy breathing as you have it can be associated with some partial obstruction of the airway and gas exchange abnormalities, or there are times when there is no such association. So that is what we mean by snoring.
Snoring.
Yes.
Okay.
Yes.
So with that, when it comes to children, is it normal for them to snore?
Okay, so we'll be very guarded with the use of normal and
unusual.
Yes.
Okay.
So the thing is that some it's a spectrum ranging from what we call primary snoring to those that have obstructive sleep apnea, and different children would fall at some point in the spectrum. So when your child is snoring, it's imperative that the child sees a health personnel. In this case, we are more interested in an ENT specialist,
Okay.
so that we can tell where in the spectrum your child falls, and then appropriate management can be initiated. What I'm trying to say is that what you may see as normal may not be normal.
Okay.
So it's important that you get the appropriate attention so we can proceed from there.
Okay. But is it very common in your daily work? Do you see a lot of children brought in and say, my child is snores at night?
Interesting.
Is common?
It's a very common, very common one. In our department, children that are snoring and interventions and procedures that we do for them are part of our daily bread and butter.
Okay.
It's amazing how many children snore.
Come in.
Yes,
Okay.
come in with snoring and all the other problems that there are with snoring. And look, it looks all benign, and with all the things that people would say about snoring, the fact that maybe you're probably sleeping so well, as I've been told, and other things. It's amazing when you also get to know about all the issues that this seemingly benign thing can do to the child. So as for children that snore, we see a lot of them. So if you realize your child is snoring, it's not so strange a thing. It's not something to be ashamed of. Come around. There's help that is available, because you see a lot of your colleagues when you come.
A lot of your classmates.
I tell you.
Okay, what is actually causing them to snore? Is there a cause of the snoring?
There is. So in children, largely we group the children that snore into three major categories. So there are some of them that don't have any problems, with the exception of a particular common reason why children snore. That is enlargement of adenoids and then tonsils. So almost all children have a certain tissue at the back of the nose that we call adenoids, and those adenoids can enlarge and then narrow the airway and then produce a resistance to airflow that we talked about.
I understand those ones, as they grow,
yes.
Does it disappear?
Okay, so this is the natural history of those adenoids.
Okay.
Every child born has adenoids, and the adenoids increase in size progressively from childhood, continually increase in size. In fact, the first 2 years is very rapid increase in size. Then 2 to 7, it will still keep on increasing in size. The rate of increase in size kind of plateaus around age 7. So the rate will plateau, but it doesn't mean it will not continue increasing in size, and continue until about age 15.
15.
Then from 15 years, it starts shrinking.
Okay.
So adults don't have adenoids. If I see an adult that has adenoids, I have to investigate you, because you are not supposed to.
You're
by
not
principle.
supposed to.
Yes, I mean, for every rule,
It doesn't do any it doesn't have any benefit
it
to them.
does have benefits. So the adenoids and the tonsils are more like the first point of call for microorganic germs. Germs that are coming through your nose, coming through your mouth.
Yeah.
They are the ones that would alert the body there is something foreign, and then try and mount a response, etc. Just that unfortunately, some people, the attempt to mount a response ends up creating problems like the airway obstruction that we are talking about with all the attendant problems that it comes with. Yes, essentially so. So that is one category. Those that have adenoids and then tonsils. Then there are also some of the children that are obese. They are big, Somebody like me has tried increasing in size from childhood
countless
up
times,
now.
right? So where you are.
And some people are blessed to, have very that kind of thing. They some people that respond to nutrition.
Okay.
But obesity is one of the chief causes of snoring. Obesity, childhood obesity, that kind of thing is one of the chief causes. So these obese children, it may, for them, the snoring may just be because of the obesity alone, or they may have the adenoids and the tonsils in addition. Because yes, the fact that you are obese does not necessarily exclude you from having any of these. Then there is another category where they have abnormalities of the face and the head. We call them craniofacial abnormalities. The cranium, as in the skull, and then the face, facial bones, and then the spaces in the head and neck region that are narrower than normal. So children that have, syndromic looking children that once you look at them, you realize there's a difference.
Just by spotting them, you know that.
Yes. So children that have, for instance, Down syndrome, other medical conditions, some of them called Treacher-Collins, cerebral palsy children also. Yes, because of the muscle tone abnormalities that they have. Some of these children also would end up snoring. So that's generally the category of children that you will see snoring. Yes, and a child may fall into one of them. And it's when you come around and we evaluate that we can tell you, this may be the problem or a combination of these and etc. to help you out. And it's important. I'm sure we'll get there along the line. So maybe I don't want to put
so some have said that sometimes when you have an allergy or a cold, those ones will be the normal.
Exactly. So a child that does not snore, but when this child picks up a cold, an upper respiratory tract infection, and then start snoring, those ones you would not be so worried about them, because we understand that the inflammation in the nose and the mucus and other things over there may narrow the airway and then make this child snore. So that is that category. Those ones will not be worried about. But the one that snores even when there is no cough, no cold, no allergy at the time, yes, those ones are ones. Yes, those are ones you need to pay particular attention to.
I actually want us to come to the warning signs. That when do you draw the line? Because at what point do you say that I need to bring my child in for medical attention?
Great. So snoring, however, benign as it looks, has been observed to produce certain effects in the children. In fact, one of the things that drew our attention to snoring was the fact that earlier on, some research someone did, he observed that snoring contributed to backwardness, in quotes, and stupidity, in quotes, in children. Meaning that these children were ones that were unable to catch up in terms of, say, academic development, cognitive function, in terms of the ability to pick up speech and other things. They realized that they were backward compared to their peers. And these were children that were snoring. So snoring contributes to delayed speech, and in delayed speech, a number of reasons why they will have delayed speech. The snorers have a tendency to have middle ear infections, which would end up making their hearing not as optimal as their peers. And once you cannot hear us, then you cannot speak.
I'm wondering how snoring has any impact on
the hearing. So this is it. At the back of the nose, we talked about the adenoids. The adenoids are indirect. They are just in very close relationship with a tube at the back of the nose that kind of equalizes pressures in the middle ear. We call that tube the eustachian tube. It just closely abuts it. So if these adenoids are so big, then they obstruct that eustachian tube and allow germs to continually go into the middle ear,
back and forth,
then means that you have recurrent ear infections. That is one. The other thing too is that these adenoids sometimes become a reservoir of bacteria. So they are constantly supplying bacteria into the middle ear, even though through the eustachian tube, even though they may not be big enough to obstruct it. But because of their constant supply, they become a reservoir, constantly supplying bacteria. And so their children will have recurrent ear infections. And once an ear infection is there, then the hearing will not be optimal.
Definitely.
So this child may be delayed
Okay.
in speech. Again, the adenoids have been seen to influence the behavior, the neurodevelopmental behavior of the children. So their memory, etc., affected for two reasons. One is that the how much oxygen there is in these children when they are sleeping is lowered. We call it hypoxia, and the brain and oxygen demand is, the brain requires a lot of oxygen. Once there's a poor oxygen supply, brain development becomes a problem. Then the other thing too is that there are for children that are snoring, some of them have fragmented sleep, and then also times when there are neural pathways that consolidate memory, that rely on good sleep. So once the sleep is poor, then those neural pathways are affected, and so this child is not performing well in school.
Okay,
not because
that's to affect their performance in school.
Exactly.
Okay.
And then additionally, the child may not also be hearing well. So here is a child that, in terms of cognitive development, there's a problem, and then in terms of hearing too, there's a problem, etc. So that is about their development. There's some of the children that are all hyperactive and not unable to focus and pay attention. Some of them are because of the adenoids. There are also some of the children that are unable to stop bedwetting at the time we expect them to. Yes, you are doing potty training, you are doing all of those things, and this child is not picking it up because this child is persistently snoring. The receptors, some of the receptors that allow us to have bladder function, be able to be aware. Yes, that wants you. Yes, some of their development is affected by the snoring.
Okay.
And then there are some children that can go to that at the extreme end where they start having heart problems. Yes, a part of the heart can fail. The right part, we call it cor pulmonale, can fail because of snoring. So it is not as benign as we see it.
Okay.
And that is the reason why once your child is snoring, etc., don't just sit home. Come around and let's examine, evaluate this your child. By asking these questions, you'll know whether this child is one that needs help, or this one we can put in a few interventions here and then we'll be fine.
Okay.
But that one cannot be evaluated by you, obviously.
Definitely.
So that's about it.
Okay. Usually does a sound matter? Some is louder, some is
others. Well, we will just maybe in terms of our literature, we don't have something directly written like that. But if you want to reason it out, because the snoring is because of resistance to airflow and turbulence generated, and it maybe stands to hold that the greater the narrowing of the airway, the greater the resistance, and the greater the turbulence, and the greater the sound, sort of.
Okay.
Yes.
Okay.
Yes.
Okay. Okay. Well, it's just 30 minutes at the top of the I have here Dr. Kwabena Jenny Mboate, ENT specialist from Kolibi. We're discussing snoring in children. We say thank you to our sponsor, Back Specialist Hospital and Fertility Center. Visit their center for all services, including IVF, IU, and other fertility services. They do child health and pediatrics, women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, the surgical service, that with general surgery and plastic surgery. There's theater service, and then laboratory and ultrasound scan service, amongst others. Locate them right in Accra, in Taifa, or call them on 0558 862 292 or 0592 196 003. Back Specialist Hospital and Fertility Center, integrity and excellence in health care. Don't forget, we are live on Facebook. Check out our Facebook page, Cradle to Crayon Show, and also Sunny FM Facebook page, and also on Sunny TV. Whatever questions, comments can put on our Facebook page, my doctor here will answer you. Also, our phone lines have been open. Number to call is 0540 130 684 0540 130 684. You can drop us a message or also call in. My doctor here will answer you. So typically when they are brought in, how do you assess them? Okay. Do you then, go to sleep and then let's see whether really you are snoring louder or this?
All right. So the assessment of the children starts with our gathering information from the parents. Obviously, the parents would have observed this child sleep, and then during the day as well. You see, the children that snore have both the night symptoms that they give, and the night symptoms are typically the snoring and other things that would ask you.
Okay.
And then they also have some daytime symptoms that they show. And so we would gather this information from the parents to be able to also know where the child falls in terms of the spectrum that I told about. Then when after gathering all this information, then we would go ahead and examine the child. So in examining the child, we are examining the child's nose to be sure there are not other things, because this child may be snoring because there is a swelling in the nose, and it really does not even have anything to do with the adenoids or the tonsils or obesity or the head and face abnormalities I'm talking about. It may just be that there's something in this child's nose. There are some of the children too that have allergies, and so they have this persistent nasal obstruction. The nose is blocked persistently because of the allergies. That will be able to also pick up on examining the nose and other signs. The children that snore, even the look on their face tells us there's a certain look that children
when you
snore,
see, you know.
Yes, we know that this child has been snoring.
Okay.
And when we see that look, it's part of the information gathering to make you know that this your child requires intervention, or does not require intervention, because there's a characteristic face. The adenoids and tonsils and all the snoring and other things kind of give them a picture.
Okay.
Yeah, I mean, it gives them a certain look in their
Okay.
face. So that is it. And then we also examine the throats, be sure about the size of the tonsils and whether the size is enough to be blocking the airway, etc. Then we would examine the ear as well. I mentioned to you that there's children that snore have a tendency to have ear infections, etc. So we have to examine the ear, and then of course looking at the child also. The children that have their face and head abnormalities, as I mentioned earlier, their look on their face and their structures, the eye, how the nose looks, the eye, the ears look, etc. All those things are things that we examine. Then we would also, we may examine other places depending on information that we pick up, the heart, etc. And then we'll go on to request some investigations. Some of them will be x-rays. Yes, looking at x-rays to help us look at the back of the nose, because we can't see the adenoids with our eyes. It's far back at the back of the nose. It's x-rays that will help us to know, to see them, and also to see the extent of narrowing that they have caused. And then some of the children, we may also ask for a hearing assessment test, because the adenoids may be given, the snoring may be complicating in, for instance, delayed speech, etc., or poor hearing, and we'll have to request a hearing assessment test to be sure, and then to intervene if we need to. Some of them would, require that we examine the heart. Because some children unfortunately develop heart problems because of snoring. And there is a certain investigation that helps us to really, really confirm, put our fingers to the fact that this child is obstructed, and so is suffering from that obstructive sleep apnea I told you about. Yes, we call it polysomnography.
So that's how different is that from the snoring?
So so this is it. Children that are snoring can. Okay, so let me put it this way. Not all children that are snoring have obstructive sleep apnea.
Okay.
But all children with obstructive sleep apnea snore. So the snoring is the greater umbrella.
Okay.
The obstructive sleep apnea falls within the snorers.
Okay. In my plain man's idea, when it's obstructive sleep apnea, it means your sleep is obstructed. You're not able to sleep well.
So you're not
is
able
that what it
to
means?
sleep well, and when we do other investigations, we realize that there are times when your oxygen saturation comes down.
Okay.
And then also, you also have other complications like having your heart rate goes up, your oxygen concentration comes down. And then these children, if it is the children, they have additional things like hyperactivity, poor attention, poor academic performance, etc. So we combine all of those to say that this child is obstructed, and so has obstructive sleep apnea. Yes.
Okay.
Yes.
When I watch movies like the European movies, I realize that when it comes to this, they ask the children to stay in, you sleep, they assess. So is that the same treatment you do here?
So we do that for let me say that that particular one, that's what you are talking about, is what we call the polysomnography.
Okay.
It's not in widespread use in the country at
Okay.
the moment, but it's available.
Available.
And some of the children where we are not very sure, I mean, what it is and etc., then we, as it stands now, we would request for that one, get it done so that we can confirm.
Okay.
But that's really the gold standard. But you know, in our country and the resources that are available, there are some things that we are able to do freely, and others that would require some stretch to do. But the point is that your information that we gather from you and our examination findings are able to help us to largely determine what it is, which category to put the child in, and which treatments to give the child.
Okay, okay. So talking about treatment, are there the point when you give medication, or there's a home remedies that you experiment to help them to do so they can stop the snoring?
So the treatments, there are medicines that we use. There are other non-medicinal things that we do, and then there are surgeries that we do. So for instance, a child that is obese, we would want you to get this child to subject a child to diet therapy and exercise. We may ask you to go and see the dietitians and etc. We may give some medicines in addition to that child that's obese, depending on whether we think the adenoids are a part of it, etc. But many of the children, we start with medicines for them. There are particular medicines that will give these children over a certain duration, and those that respond well to the medicines, there will be no need going to do surgery. But
surgery,
surgery, yes. So if you respond well to the medicines, we are all happy, hallelujah, we let you go. But if you don't respond to the medicines, then we may have to do surgery. What surgery do? We remove the adenoids and plus or minus the tonsils. So and essentially the principle is that we are trying to open up the airways. The adenoids and the tonsils that have narrowed your airway. So open it up, give more space, remove them. And
you are good to
they
go.
are good. Their children are good. Yeah.
Okay.
Yes.
Talking about snoring in detail, it sounds very scary. Because talking about your hearing, your heart, and all that.
Your development of your brain.
Because I'm sure there are some few parents out there whose children have snored and they will outgrow. When they are older, they will stop. Would it happen?
Well, when you are older, like I mentioned, if you are thinking about just the adenoids, for instance, then we are looking at 15 and above. Would you want to wait till your child is 15 years every night with all the problems that there are, including heart problems that your child can get? Would you want to wait till this child is 15 years so that nature will take its course? Certainly, for many of us, we would not want to. So you want to come, let us evaluate, and then see. Maybe the medicines will be enough for your child.
Okay.
And then we move on from there. Yeah.
Okay. You know, I've heard myth. People say that when your child is snoring, it means he's fast asleep, like all day. I don't know whether it's you've heard this before.
Yeah, I've heard it. I've heard it today.
Okay. They are saying that the child is sleeping very well.
It's like some of the myths that we have, like you are sleeping, and be like you are sleeping like a baby.
You're sleeping like a sound.
But we don't know that babies have very interrupted sleep, especially at night. So if you say I'm sleeping like a baby, you mean my sleep is fragmented. So the thing that what people think about snoring and the fact that you are deeply asleep is not the case, because in fact the snorers have fragmented sleep. The snoring and the fact that sometimes they have intermittent obstruction. The obstruction is like they can't sleep, breathe at all. So the body wakes them up.
Okay.
And then they go back to sleep, then they are waking up again. So it's fragmented sleep. It does not allow them to sleep well at all. And so if you say I'm snoring and I'm deeply asleep, that one certainly
doesn't
not
work
the case.
like that.
Yes.
It doesn't.
Yes.
The others too that hear that when they are snoring, because you said they are sleeping on their on their lungs or what. So let them lie down well, you adjust them well, and then they'll stop. Does it work?
Well, for some of the children, like I say, if you have the lower end of the spectrum, the primary snorers, some of them, the change in posture may be okay for them. But many of them, after the change in posture, they will get back and then go and sleep. Besides snorers, one of the issues with snoring children is that they are very restless, and so they keep on tossing and turning, and changing positions, lying on their bellies, etc.
Okay.
Yeah.
Okay. It's just a minute to go. Your final words to parents whose children are snoring that have ignored over the months, over the years, what do you have to tell them, or some remedies that can help the children do at home?
Great. So snoring, as we've talked about, can be harmful, and it's a spectrum. Your child may fall in the category where there's not much of a problem, and then there are times when the child can really have a problem. I would encourage all parents, if your child is snoring, pass through an ENT practice. Come around, let's evaluate your child, and then we can properly intervene so your child would not suffer some of the problems that we have enumerated above. Thank you so much.
Thank you so much, Doctor. Thank you for coming again. We'd love to have you another time.
Thank you so much, Abigail.
Yes.
Thank you for
Yes.
having me.
Yes.
It's wonderful to meet your listeners.
Yes. And then to all those who listen, those who watched us on Sunny TV, we say thank you. Don't forget, tomorrow morning, same time, 9:30, will be a repeat broadcast on TV. Have a good working day. Thank you to the guys here, to Eugene, to Bless, to Ezekiel as well. Have a good working day and enjoy your weekend. Bye-bye. From infancy to adolescence, from prenatal care to safe motherhood, we discuss it all. Maternal health, vaccinations, infant nutrition, preventive care, mental, physical, and emotional wellness of both the mother and baby. We talk about what truly matters here. Tune in to Sunny 88.7 FM and also on Sunny TV every Friday morning from 9:30 a.m. to 10 a.m. Also a repeat broadcast on Saturday morning from 9:30 as we bring to you the Cradle to Crayon Show. Join me and my team of doctors and health experts as we answer your questions, give you expert advice, clear all myths, and also share real solutions. Remember that informed parents raise healthy children, and healthy children build a stronger future. See you.